Today we will talk about PEG 3350-Sod Sulf Chlor-Pot-Mag 178.7-7.3-0.5-1.12-0.9 Gram Oral Soln. This medication is used to clean out the intestines before certain bowel exam procedures such as colonoscopy or barium enema X-rays. It is a laxative that works by drawing large amounts of water into the colon, resulting in watery bowel movements. This helps to clear stool from the intestines, allowing your doctor to better examine the intestines during your procedure. The daily dosage and optimal timing for taking this medication will be determined by your doctor, so be sure to follow their instructions carefully. If your doctor has provided a medication guide, be sure to read it before starting this product. It's important to follow any special diet instructions given by your doctor, which may include avoiding solid foods before and after your procedure. Before using this product, you will need to mix it with water as directed. Once mixed, store the container in the refrigerator as chilling the liquid will improve its taste. It's important to note that this product may affect the effectiveness of certain liquid thickeners, so if you are using them, speak to your pharmacist about choosing one that will not interact with this product. The dosage of this product will depend on your medical condition, procedure, and how you respond to the treatment. Drink the mixture as directed by your doctor, and it's best to drink it quickly rather than slowly sipping it. If necessary, the mixture can also be given through a nasogastric tube. You can expect watery bowel movements to start within an hour of drinking the mixed liquid, so be sure to drink plenty of clear liquids as directed by your doctor to prevent dehydration. It's important to avoid taking other medications by mouth within an hour before starting this product, as it may affect the effectiveness of the other medications. If you have any concerns or questions about timing, be sure to speak with your doctor or pharmacist. If you experience nausea, bloating, or feelings of fullness in the stomach or abdomen, it is very common. Stomach or abdominal cramps, vomiting, and anal irritation occur less often. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, including severe or persistent stomach/abdominal pain, bloody or coffee ground-like vomit, chest pain, fainting, fast or irregular heartbeat, sudden shortness of breath, bloody stools, rectal bleeding, seizure, or signs of kidney problems such as changes in urine output. A severe allergic reaction to this drug is rare, but seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed above, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. Before taking this medication, it's important to let your doctor or pharmacist know about any allergies you may have. This product may contain inactive ingredients that can cause allergic reactions or other problems. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have certain stomach or intestinal problems, trouble swallowing, heart problems, kidney problems, seizure disorder, or mineral imbalances. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using. For children, it's important to be aware that they may be more sensitive to the side effects of this drug, especially dehydration. Room temperature solution is better for infants. Children younger than 2 years may be more likely to develop low blood sugar from not eating, so it's important to seek medical help if you notice any symptoms of low blood sugar in your child. During pregnancy, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding, as it is unknown if this drug passes into breast milk. When taking this medication, it is important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. You should not start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If someone has taken too much of this medication and is experiencing severe symptoms like losing consciousness or difficulty breathing, it is crucial to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. This medication should not be shared with others. This oral solution is a combination of PEG 3350, sodium sulfate, sodium chloride, potassium chloride, and magnesium chloride, which is used to treat occasional constipation. It works by increasing the water content and bulk of the stool, which helps to ease bowel movements. This medication is usually taken once a day, or as directed by your doctor. It is best to take it at the same time each day. The dosage is based on your medical condition and response to therapy. Be sure to drink plenty of fluids while taking this medication to help prevent dehydration. When it comes to storing this medication, it's important to follow the specific instructions provided by the manufacturer. Make sure to keep it in a safe place away from children and pets. And when it comes to disposal, don't flush it down the toilet or pour it into the drain unless directed to do so. Instead, properly discard the product when it's expired or no longer needed. If you're unsure about how to dispose of it, consult with your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.